Good day, I'm Jose Ramon Mendoza Matyong, representing 407 Group Number 2. In discussing knowledge and skills assessment of selected year level of nursing students regarding male client education regarding testicular self-examination. Testicular cancer is a solid tumor in the testes, most common in men aged 15 to 35. The cause of the cancer is unknown, but there are risk factors that can lead to the etiology of the tumor. According to Bohenkamp and Yoder, risk factors would be old age pregnancies, smoking, and alcohol drinking. According to Bohenkamp and Yoder, Scandinavia, Switzerland, New Zealand, and Germany have the highest rates of detection of testicular cancer, while in Asia it is almost non-existent. In the surveillance, epidemiology, and end results, there is 1 in 270 chance of being diagnosed with testicular cancer, while according to Davis, there is 5.4 cases per 100,000 in men. According to Castillo, women have their sources of knowledge in performing breast self-examination for early detection of breast cancer. Advices for men to do testicular self-exam have not been equally popular as breast self-examination. Therefore, further expansion of teaching and demonstration to the male population must be implemented by the nurse and the student nurses as well. According to Bohenkamp and Yoder, nurses play a big role in providing male patient education and support regarding testicular cancer. But previous studies have shown that primary healthcare providers do not examine their patients' testes nor educate their male patients regarding early detection of testicular cancer. Since knowledge and skills play a big role in testicular self-examination, lack of it could be a factor for nurses not to educate their male clients. So the researchers decided to assess the level of knowledge, skills, and attitude of student nurses trained in different curriculums of Bachelor of Science in Nursing and performing testicular self-examination to male clients in order to determine their sources of knowledge that may affect their awareness. The results from the conducted test from the 2-year levels will be compared and the sources of knowledge will be correlated so as to determine which among the sources of knowledge greatly influenced them. The 3rd year, one of the researchers' target group trained in CHED Memorandum Order Number 5 Series of 2008, which is the new curriculum, in comparison with the 4th year level, the other target group of the researchers is trained in CHED Memorandum Order Number 30 Series of 1994. In the conceptual framework, in the upper box, it shows the source of knowledge of students, which are the physical assessment concept, the reproductive system concept, and the fundamentals of nursing. These sources of knowledge can be used in the related learning experience. With these sources of knowledge and experiences, it can increase the level of the students' knowledge and skills regarding testicular self-examination. While in the attitude, it is a big factor that can contribute to the outlook of the level of knowledge or skills of students regarding testicular self-examination. Our first objective is to determine and compare the level of knowledge and skills of nursing students trained in the old and new curriculum of the Bachelor of Science in Nursing. Second, to determine and compare sources of knowledge and skills. Third, to correlate level of attitude with the sources of knowledge. And lastly, to correlate knowledge, skills, and attitude. We have 2 kinds of studies, the correlational and the descriptive study. In the correlational study, it is used to determine the relationship between factors such as physical assessment concept, reproductive system concept, fundamentals of nursing concept, and the student's level of knowledge and skills in performing testicular self-examination. While in the descriptive study, it is used to observe and describe the student's knowledge in performing testicular self-examination. In our questionnaire, it is composed of knowledge assessment, skills assessment, attitude, and sources of knowledge. In the knowledge assessment, it is composed of 16 questions, 15 quantitative and 1 qualitative. It is used to test the respondent's knowledge on TSE and testicular cancer. While in the skills assessment, it is composed of 11 questions, 10 quantitative and 1 qualitative question. It is used to test the respondent's skills when performing testicular self-exam. In the attitude, it is composed of 10 questions, purely quantitative. It tests the respondent's perception of learning and interest in different aspects of learning. While in the sources of knowledge, it is in a checklist format. to determine the source of knowledge of the students regarding the particular self-examination. The data gathering technique started when the researchers gathered data needed in the research, then submitted a letter to the dean for permission to conduct the survey. Also, they submitted a letter to the research analyst for validation of the survey. Then the researchers started gathering data in one of the top nursing schools in the Philippines. The third year level of nursing students in the new curriculum and the fourth year level of nursing students in the old curriculum. Each year level is divided into 2 teams, and each team is represented by one section, and their class presidents disseminated the questionnaires to the student respondents. K1 to K15 is a code for each question for assessment of the level of knowledge. S1 to S10 is a code for each question, assessment of level of skills, and A1 to A10 is a code for each question for assessment of attitude. These are the results of third year and fourth year students in answering questions of knowledge regarding the particular self-exam. These are computed into means, and each was evaluated with interpretation. The highlighted figures are the ones highest score for each question. For example, in K1, the third year student had a mean of 4.56, which is very satisfactory, while the fourth year students in the K1 question had a mean of 4.78, which was also very satisfactory. But the fourth year students had the higher mean, so the fourth year students were the ones that were highlighted. These are the results of the qualitative question on preparation of testicular self-examination of third year student respondents. While these are the results of the qualitative questions on the preparation of testicular self-examination of the fourth year respondents. Since fourth year respondents' mean is most of the time higher, showing 11 out of the 15 statements higher than the means of the third year, this connotes that fourth year nursing students is a bit higher in confidence in answering the question compared to the third year as indicated in the chart of means. These are the results of third year and fourth year students in answering questions of skills regarding testicular self-examination. These are computed into means, and each was evaluated with interpretation. The highlighted figures are the ones highest score for each question. For example, in question S1, the third year students had a mean of 3.81, which was satisfactory, while the fourth year students in question S1 had a mean of 3.65, which is also satisfactory. But the third year students had the higher mean, which is 3.81, so they were the ones who were highlighted. These are the results of the qualitative questions on procedure during testicular self-examination of the third year respondents, while these are the results of the qualitative questions on the procedure during testicular self-examination of the fourth year respondents. Both the means of the third year and fourth year nursing students show no significant difference. Therefore, level of skills is almost equal in terms of confidence. There are no significant differences of scores obtained in knowledge and skills and overall scores of the third year and fourth year nursing student in regards to testicular self-examination. Although the third year and fourth year are in different level and in different curriculums, this has not been a factor to result a significant difference in their knowledge and skills. Instead, the resulting data showed no significant differences at all. It is because there are sources of knowledge that compensated for the absence of the other. As illustrated in the figure below, physical assessment concept, which represent the source of third year, is not included in the curriculum of the fourth year, while the pediatric concept and the reproductive concept served as the source of the fourth year, which is not yet taken by the third year when the survey was conducted. Physical assessment is not included in the curriculum of the fourth year students, but they were introduced to this through their fundamental of nursing concept and the related learning experience, which is not as good as the physical assessment concept of the third year, since they took it as a general subject. The same with the third year, reproductive concept is not yet taken by the third year when the survey was conducted. Still, they indicate this as their source because this was introduced to them in their RLE and maternal concept. Also, some of the students from their respective year level indicate that they were not able to encounter discussions during or regarding testicular self-examination. This reflected on the assessment of attitude in both of the two different year levels during lecture and RLE. An example of this, they evaluated themselves as poor for questions that asked about how they acquired the knowledge discussed in the classroom and their interest in the subject. The third year and fourth year respondents are aware of the basic knowledge of testicular self-exam, but still lack more comprehension on it. Although there is only a small number of incidents of testicular cancer worldwide, it is still the role of a nurse to help their male clients and teach them regarding testicular self-examination. Therefore, nurses should have enough knowledge and skills regarding testicular self-examination. Instructors could expand their teachings of testicular self-examination in order for the students to enhance their knowledge and skills. They must encourage the students to provide health teachings and demonstrate to their male clients for them to be able to perform it independently. The researchers recommended the students that they should expand their knowledge and skills regarding testicular self-examination and share it with their colleagues in order for them to be able to be capable of teaching to their male clients. Next, the researchers recommend the instructors to have a sufficient knowledge regarding testicular self-examination, which is necessary in teaching their students, which could help the students gain more knowledge and skills. Next, the researchers recommend the future researcher that they could emphasize in implementing the health teachings to the patient and focus on the sources of knowledge and skills of the students and able to improve it. For the institution, to enhance their competencies, their instructors, in providing knowledge and skills in providing testicular self-examination, in order to help student nurses to broaden their knowledge and skills regarding testicular self-examination. Thank you for listening to my presentation. I hope it was fruitful and knowledgeable for you. Again, my name is Jose Ramon Mendoza Matyong, representing 4NU7, group number 2. Good day.